The views expressed are solely those of the speaker and not necessarily those of Paltalk.com, AVM Software, or its advertisers.
News Talk is online. News Talk Online is a production of Paltalk.com, the largest multimedia interactive program on the internet with more than 4 million unique users on demand on iTunes and on YouTube and on my blog, GaryBaumgarten.com, where you're encouraged to post your comments, whether you agree with yours truly or not. And if you happen to be a supporter of Karl Rove, I recommend you go to my blog because all the comments, except for one or two, and they're like 2 dozen or 3 dozen comments in there, are supportive of the fact that Karl Rove is being forced to testify to the House Judiciary Committee, something that the Bush administration tried to obviate, but a judge precluded them from using an extension of executive privilege after that administration was out of office. And Rove will be testifying about the administration's reasons for firing various U.S. attorneys across the country, allegedly for political reasons. He'll be testifying by deposition. And I wrote that blog yesterday morning, and it's just amazing the number of comments that have been written, very supportive of the fact that Karl Rove is going to be sworn to testify under oath, under threat of perjury. And if there are those of you who disagree with that point of view and believe that he ought not to be testifying, I'd like to hear what you have to say, because the comments have been very balanced or unbalanced, or how would you say it? It's balanced in one direction. It's not balanced. They're not balanced. Haven't seen very many people supportive of the former administration. But I digress. That's not why we are here today. And by the way, we are syndicated by CRN Digital Talk Radio, our good friends there, to an additional 12 million households. I am your host, Gary Baumgarten. Welcome to the show. To my right, your left is our guest. President Obama today convened a summit of 120 people on health care reform, declaring that the nation, which has the world's costliest health care system, cannot afford to wait for the economy to recover before reining in some of those costs. But how should this be done? What model should we be following? Well, here in the studio to discuss today's summit and to take a look at how other countries are tackling this problem is Timothy Foley, who writes on health issues for change.org. Tim has been an online organizer and blogger on healthcare policy for the Obama for America campaign and currently for the Committee of Interns and Residents at the SEIU Union. It's a labor union for intern and resident doctors. Tim Foley, welcome to News Talk Online on Paltalk.com.
Thanks for having me on the show.
Well, great to have you here. And I didn't know when I invited you here that there would be absolutely breaking news about healthcare, and that is, no, not the summit at the White House, but my online producer and show screener, Boaz Franco, has a terrible ear infection.
Oh, my goodness. See,
and
that's the worst.
I don't know whether he has sufficient health care to cover the treatment that he needs for that. And that's very important to me because, as the people who are regulars on the show know, I sometimes yell at Boaz.
Mm-hmm.
I give him a hard time during the show.
It's important the ears are clear.
Well, now he has an excuse to ignore me. So I'm hoping, Boaz, really, all joking aside, that you get better soon. I want all of you to send good tidings and hopes for that ear infection to clear up.
What was that you said, Gary? I couldn't hear you.
Yeah, very funny, Boaz. Thank you very much. That was good. Thank you very much. But there is actually breaking news, and I want to talk to you about the issues that you wrote about that caused me to invite you to the show. But I was really, I guess, as much as I have covered this issue, Tim, I guess I didn't realize that the highest healthcare costs in the world are right here in the United States, and I'm wondering, why is that?
Well, it's actually not just the highest healthcare costs in the world, but also quality that is not as high as our costs would suggest. One of the major problems is that we have, well, I like to sort of phrase it that the healthcare system in the U.S. really only has three problems. If we solve those three problems, we'll be fine. Number one is it's not as good as we think it is, especially compared to when you look at things like how long we're living, what our infant mortality rate is, things that you would think a reasonable country, in fact, the remaining superpower would score very well on. We don't score as well compared to other.
I'm going to interrupt you on that before you get to the other 2 points because I'll forget. That could be due to environmental issues and lifestyle issues more so than healthcare issues.
Some of them do, but for example, one of the cheapest countries as far as healthcare coverage is Japan. And one of the main indicators of Japan that you would think would make them more competitive is smoking, for example.
Right, they smoke like chimneys.
The smoking rate in Japan is 26.3% of the population. In the U.S., it's 16.9%.
And yet the mortality rate is higher here per capita than
Exactly. They have the longest life expectancy in the world. They have one of the lowest infant mortality rates, and even more telling, their healthcare system costs about a third per person what we're currently spending.
Yeah, but other than the sumo wrestlers, have you ever seen a fat Japanese person? It's very, very rare.
Well, and that's a big part of our healthcare problem is that the United
We're all
States...
obese. We are all obese.
A higher
I have to
percentage.
lose weight. I have to lose weight. You come in here, you look great, and, I don't want people to be watching us on cam and making the comparison, and I'm going to get cards and letters and phone calls and emails saying, Gary, you have to lose weight, and it's true. I have picked up a little weight over the winter, and it has to do with my lifestyle and my eating habits. They've really fallen into, so I can't blame that on the healthcare system. That's my choice.
That's true. However, the healthcare system winds up paying for it, whether it's the healthcare system's fault or not.
Right.
So, for example, obesity has been tied to things like diabetes, a chronic condition. It's also been tied to things like hypertension, high blood pressure, heart disease, so on and so forth. So you may think you're just putting on a few extra pounds, but depending on the rest of your genetic makeup, you could actually be putting a strain on your health. You won't see it right away, but you'll certainly see it down the road. The good news is, if you've got good health coverage, that's not going to be a problem. You're going to get it treated early on when it's relatively easy to treat. In some cases, they can catch some types of diabetes before it even develops. If you don't have good health insurance, if you don't have access to a primary care physician, you're going to catch that very late, and it's going to be very expensive, and it's going to be, frankly, be very inefficient and very wasteful. And unfortunately, that's pretty common. There was a study done by the RAND Corporation that says Americans overall get the primary care and preventative care we need only 55% of the time. And I think we can all agree, no matter whether you have health insurance or not, that that's just a shocking number. That means you've got a 1 in 2 chance of actually being able to do something about our spiraling healthcare costs by catching it when it's early.
And 2 other points?
Two other points. So first of all, we're not as good as we think we are in terms of quality compared to other countries. We're not bad on some things, but obviously if we're only getting primary care 55% of the time, that's a problem. Number 2 is that we cost too much. The next closest is Switzerland, and they pay 2/3 of what we pay. And that's not just a problem for those who don't have coverage. It's become a huge problem for those who do have coverage. This year, according to the latest government statistics that came out, we're going to spend $8,000 per person in this country for health care. And we're seeing the results of that on businesses, on small businesses.